And there we go. So hi everybody, my name is Nicola Salmon. I'm an acupuncturist, I'm a fertility coach, I'm a naturopath. And today I'm really excited to share with you all about the benefits of acupuncture for fertility. So the first thing that I wanted to talk about was why acupuncture, because there are so many therapies, there are so many treatments out there, so many like nutritional things you can do and supplements to take and reflexology, acupuncture, there's overwhelming amounts of things that you can do. So the reason why I think acupuncture is a really big benefit to any fertility treatment that you're going through or wherever you are on your fertility journey is because there's a lot of evidence to support it, which is quite unusual for like an alternative medicine, because there's been quite a lot of studies that show that acupuncture can be really helpful when you're going through IVF. It can be really helpful when you are trying to figure out what's going on with your hormones, if there's hormonal issues, and just readdressing and rebalancing anything that's going wrong in the body. And the benefit of acupuncture is it's a whole body treatment. So when you go and see your fertility specialist or your gynecologist, they are looking purely at your reproductive system. Whereas in acupuncture, we look at everything. So it's a whole body system treatment. So we look at digestion, we look at sleep, we look at obviously your cycle as well, but it's just a complete holistic picture, because quite often you'll find that when there's issues going on with fertility, there's other stuff going on. So it's so common to suffer from IBS as well, from sleep problems, from all of the kinds of things that are going on. So with acupuncture, you can really get to grips with kind of what's going on, get to the root of the problem, and really just being able to change it at that level. Now, if you don't really know much about acupuncture, it's a really, really old system. So it's kind of like over 5,000 years old, they think, and it's based on an energetic medicine. So it's really different from the Western medicine principles that we have in our healthcare system right now. And it was really, when I was learning about it, because I originally trained in Western medicine, it was really strange to be thinking about these entirely different concepts, because it completely flip it on its head. So in Eastern medicine, in Chinese medicine, they pay their doctor to keep them well. So instead of going to see the doctor when you're unwell, they actually go, and it's more preventative medicine where they keep them well, which is a really interesting way of thinking about medicine. And it's a really interesting way of looking at kind of how medicine works. But acupuncture has been around for thousands of years. It's based on looking at how your energy moves through your body in a way that, you're looking for blockages, you're looking for places where the energy isn't going that it should be. And it's really helping the body balance on an energetic level as a precursor for then those issues with the energy coming up in physical symptoms. So, for example, if there was an issue with your energy in your stomach channel, then it might come up with, you get bloating or you get constipation, all these different types of symptoms. So acupuncture is really great at getting to the energetic cause of problems, which then can help manifest into how they appear in our physical symptoms. Acupuncture is also really great at reducing stress. So with this journey, it is like one of the most stressful things that you'll ever do in your entire life. So it's so hard when people just say, just relax, it'll be fine. If you can just calm down, just chill out, then everything will work. But we know that that's impossible to do when people just say it. So it's really helpful to have acupuncture as a tool, because it helps your body take it from that stressed state to that relaxed state. Because there are these two states that our body can be in. So it can be in this, what's called fight or flight mode, which is where your body is in this panic mode of it's being attacked by a tiger in evolutionary terms, or being, you're being chased by a lion, where you've got to put all your resources into making your heartbeat faster, making your breathing go quicker, and getting your muscles ready to do running or to do fighting. And that's kind of our fight or flight mode. which in our culture happens now when you have a meeting with your boss, or when you've got like credit card bills piling up, all these different stresses in our life which are creating this kind of chronic stress state. And then you've got the other side of the coin, which is the rest and digest phase, which is your calm phase when you're not being chased by a lion, when you're going about your day-to-day life. And this is when your body will be able to prioritize things for digestion, so you'll be able to just digest your food better, and also reproduction. Because when you're being chased by a lion and your life is like literally hanging on a thread, you don't want to be using your resources for things like doing digestion and reproduction. So that's like how the body works on a basic level. And what acupuncture does is it takes you from that stress state to that rest state, so that your body can begin to prioritize taking all the nutrients from the food that you're eating so that you can absorb them, and really just help to rebalance things. So one of the best things that acupuncture does for the people that I see is to help them kind of rebalance their cycle. So regain that kind of regular 28 to 32 day cycle. It helps to get the blood to be more healthy, so that it's like a medium red colour, so that it's going for a couple of days at least, 3 to 5 days ideally, and it just creates a really healthy cycle, so that you're not feeling like you want to kill somebody before your period starts, so that you're not in like crazy amounts of pain as you're going through it. So that's why acupuncture, because it's just a really great way at making sure that your body is going to be in this really good state, and it helps just to rebalance all those things for you. And if you decide you want to do acupuncture, if you think that yes, this sounds like a really good thing, it's going to really help me, then it's really important to make sure that you choose the right acupuncturist for you, because there are thousands of acupuncturists out there, and the problem in the UK is that it's not a registered title, so it means anybody can call themselves an acupuncturist. And you get people who've done like a weekend course in acupuncture who can then call themselves acupuncturists, and it's not very safe, because you can needle into places where it can cause issues. You can needle into places, if you go deep enough, where you can cause your lungs to collapse and all kinds of crazy stuff. But you want to make sure that you're seeing someone who's qualified. And I did a 4-year course in acupuncture, so it makes sure that you know what you're doing, which is really important. So in the UK, we have something called the British Acupuncture Council, which is like the UK's leading body in registered acupuncturists who've done all their training, who are competent, who are qualified. And they have a website, acupuncture.org, I think it is, where you can go and check who in your local area is registered, who is available for you to go and see. And there's also fertility specialists, because with the acupuncture being a whole body system, which is amazing, it does mean that a lot of acupuncture can be generalists, and you really want to make sure that you're getting someone who knows that what's going on specifically with fertility, because it's such an in-depth subject, and especially if you're going for IVF, where everything is changing so quickly, the technology changes and moves on quite rapidly. You really want to make sure you're seeing someone who's got that knowledge, who knows what they're talking about, who knows the drugs that you might be on and their interactions, so that they can make sure that they're treating you appropriately. And there are lots of people who specialise in acupuncture, because it's quite a well-known it's really well known in the acupuncture community that acupuncture is beneficial for fertility. So a lot of people specialise in fertility. And there's a group called the Acupuncture Fertility Network, which is like a specialist group of acupuncturists in the UK who deal specifically with fertility and have trained extra hours, do regular training every year to make sure they're up to date with everything that's going on in the fertility world. So if there's an acupuncturist who's on the AFN website, then that would be also really beneficial to make sure you've got someone who knows what they're talking about with fertility. And the final thing that I think is so important when you're looking for an acupuncturist or any kind of health professional that you're working with is to make sure that you find someone who is going to be able to support you, who you're going to be able to talk to and be open and honest with. Because one of the biggest benefits that my clients talk about working with me is that they really feel that they've got a continuity of care throughout this treatment, that they really feel they've got someone they can talk to, that they can share things that they might not be able to share with their doctor or even their partner or their friends, because this can feel like a really lonely journey. And having someone that you know is not going to judge you for the questions that you ask, or knows everything that's gone on in your history so far and knows exactly where you're going next and can kind of go through that with you, is really, really useful and really important. So if you can find someone that you really gel with, that you can really talk to, that feels that you really get on with, that can be really nice to have someone like that going on the journey with you. So that's my recommendations for how to find an acupuncturist. And then I just wanted to share a little bit about my journey, because when I was growing up, I didn't know anything about acupuncture. I didn't know anything about alternative medicine. It didn't really mean anything to me. The only reason I knew what acupuncture was is because my dad had it for his bad back, and that was all I knew it for. It was good for back treatments. And then I was diagnosed with polycystic ovary syndrome when I was 16. So the doctor told me that I'd never be able to have kids when I was that age, which was a bit of a bit of a shock to the system. And got on with my life, got on with university, school, and I trained as a medical physicist, which was like a physicist working in the hospital. And then when I was doing my job at King's in London, a guy got shot outside my flat that I was living in at the time. And this was like really traumatic for me. This was a really big turning point in my life, because I really struggled after that. So I struggled from post-traumatic stress disorder. So that meant I had nightmares. I really struggled to leave the house, that I had to give up work because I couldn't get out of the house. And I tried different therapies. So I tried cognitive behavioral therapy. I tried antidepressants, and they didn't work for me. And then that's when I found acupuncture. So that's when I just wandered into this therapy center and they told me to try acupuncture. I tried it. After 6 sessions, I was able to leave the house. I was able to go back to work, and it had such a huge impact on my life that like a few months later, I signed up and started to train to be an acupuncturist, because I really needed to know how on earth this was working, like what was going on, like how this helped me, because I had really no idea like what was going on. I didn't understand how it worked. I didn't understand how it had helped, but it had, and I was really, happy that it had helped me get my life back on track. And it was because of my earlier PCOS diagnosis that I then began to specialize in fertility, because I was, I'd met my husband after I'd finished training, and we were ready to start our family. And I was quite frightened that we weren't going to have any luck, that it was going to be really difficult and really hard. And because I had made all these changes in my life, and because I'd had regular acupuncture whilst I was training and doing all these other things, I was able to start my family with no problems. And that was such a blessing for me, and I was so grateful for that. So that's kind of where I got to, now I specialise treating women with fertility problems. I live in Surbiton in southwest London, and I also do stuff online helping women, because it's so important, this work, and it's so needed for everybody to be able to get the support that they need, and to be able to find people that they can really just really get help from. Because so many times, especially if you're at the beginning of your fertility journey, you'll go to the doctor and they'll ask, have you been trying for more than a year? And if the answer's no, then they'll just say, come back later, come back when you've been trying for a year and we'll help you. But there's no support, there's no advice, there's nothing in between. And I think, getting some help from somewhere else can be really helpful for you, for your health, for your well-being, and for your quality of life. So that is kind of acupuncture in a nutshell. I am so happy to answer any questions. If you want to pop them in the chat box, if you can see the chat box, it should just be on your right hand side of your screen. Or if you want to talk on the recording, you can unmute yourself, which you should be able to do in the bottom left corner. And then you can just talk to me and we can chat. I'm absolutely happy to chat about anything that you want to chat about. Or if you want me to stop the recording and you want to talk to me after that we've done the recording, just pop a comment in the chat box and we can do that too. So I hope that's been helpful. And please do give me any questions you've got about acupuncture, about whether you think it'll be useful for what you're going through at the moment. If you've had acupuncture before and you want to share kind of what you've experienced acupuncture with, that would be amazing. Yeah, just anything you've got would be great.
Hello.
Hi.
Hi there. I've experienced acupuncture previously, quite recently actually, leading up to my embryo transfer.
Mm-hmm.
And I want to know whether there's any benefit to continuing with acupuncture thereafter.
So it's great. Yeah, during your IVF is fantastic. And then I definitely recommend having one after transfer, but before your test date, just during that implantation phase is really useful. And then after that, it varies hugely depending on how you're feeling, what the result is. So often if people have been, if had 2 embryos transferred and they are expecting twins, then I really encourage them to get further support through that, because that can be quite tough on the body. If you're having any side effects, so if you're feeling nauseous, if you're, getting really bad like cramping or any kind of other early pregnancy symptoms, acupuncture can be really, really helpful at helping resolve those. So it can be really helpful with that as well. But yeah, and also how you're feeling mentally, I think, is really important as well. So if you're feeling anxious or stressed or really struggling to feel calm and confident about the pregnancy, then it can be really helpful with managing symptoms like that as well. So there's lots of different reasons why you might want to continue. But then if you're feeling healthy, if you're feeling well, acupuncture can just be there as like a backup, so that if you start to feel a bit stressed, not sleeping, then it can be great to go back to later.
Okay, thank you.
That help?
Yes, thank you.
Good. Okay, so we've got a few questions in the chat. Someone says, are there any times when acupuncture isn't advised? So there are specific medical conditions where acupuncture might not be helpful. Specific ones that, if you've got a blood clotting disorder, these are quite rare conditions. Like if you've got a blood clotting disorder, then you'll need to make your acupuncturist aware of that, and depending on the severity of it, you may not be able to have treatment. If you're allergic to any of metals, so any of the specific acupuncture needles, then that's something when acupuncture wouldn't be helpful. Sometimes if you're afraid of needles, then that can be a bit of a barrier towards acupuncture. I mean, acupuncture needles are very different to the needles that you'd be injecting yourself with if you're going through IVF or if you have a vaccine or something like that. So acupuncture needles are actually about the size of a hair, so they're really, really fine, and they don't feel anything like having an injection. But if you've got a real phobia around needles, then sometimes that can really make you more stressed than you started with, which obviously isn't a great benefit, and obviously you're not getting the best out of it. So those are kind of the main things that I would say acupuncture might not be the best treatment. But for most kind of general health conditions, for most things that are going on, acupuncture can really help. So there wouldn't be anything else where there may be an issue. So I hope that's helpful. Someone says, what's the difference between Korean acupuncture and Chinese acupuncture? So there are lots and lots of different types of acupuncture. There is 2 different types of Chinese acupuncture, something called traditional Chinese medicine acupuncture and 5 elements acupuncture. There's Korean acupuncture, there's Japanese acupuncture. There is a lot of different philosophies around this, because as well as the medicine, it comes with its own philosophies and ideals and cultures really based on the medicine. So I think I'm not an expert in Korean acupuncture. I'm a traditional Chinese medicine acupuncturist, but I believe Korean acupuncture uses quite a lot of points on the hand. So I think they have quite different points that they use, and they treat mainly on the hand. Japanese acupuncture, I know they put the needles in and out really quickly. And it's just the framework that they use to diagnose and treat. The points are mainly the same. The results are mainly the same. It's just the way that the medicine has grown up, because they've all come from different geographical areas, as the names suggest. And it's all the same medicine, but it's just the way that they've grown up and the stories that they've created around it, and how they've brought that medicine alive in their own specific cultures. I hope that's helpful. Someone says, how soon before treatment would you recommend acupuncture? How many would be beneficial before? So if you're going for any kind of art treatment, any kind of IVF or ICSI or IUI, the best thing you can do is at least 3 months before. But if you can't do that, if you're already closer, then anything that you can have is better than nothing. So the reason I say 3 months is because that gives you a really good time to make a difference on egg quality and impact on egg quality before your treatment. But the more you can have up until the treatment, the better. Like, you can make huge differences in like the balance of the hormones and your immune system and your digestion and your sleep. All these things are going to have a huge impact on your health and your well-being in the run-up, which obviously the better you're feeling, the more healthy you are, the better chance you're giving yourself of it working. And how many would be beneficial? So I recommend having it weekly in the run-up to any kind of treatment. And then I have a specific protocol that I use for an IVF. So it would be weekly again. Obviously, this depends on which protocol you're using as well, because there are lots of different different clinics use different protocols. So it would be, weekly, and then I do one after the trigger shot. So between trigger shot and egg collection. Then normally one pre and post transfer within 24 hours of transfer, because there's been a lot of evidence to show that increases, just those 2 treatments alone can really increase rates of success, which is incredible. And then one after transfer around implantation time, just to really help the body get everything it needs for implantation. So I hope that is helpful. And then just going into some extra questions. How long does a typical session last for? So I normally we normally have a 45-minute session in a regular session, and that is like catching up time. So we talk about what's been going on, how your health's been, how you're feeling, and then it's normally needles in, 20 minutes on the couch with some relaxing music, just to kind of get you into that stress-free state and help making the needles do their thing, and then just taking them out and off you go. So you'd normally have the needles in for about 20 minutes. How many sessions would you recommend, and at what intervals? So normally the thing with acupuncture is that it really depends on how long you've had the condition to how many sessions you'll need. So for IVF, I've already talked about that before, but if it's something else, if it's just general fertility, I've had patients that I've seen for a couple of months, and that's been enough to just kickstart things, to get the hormones moving in the right way, to really make the changes, and then they've got pregnant. It's just been a couple of months, and that's been at weekly intervals, because acupuncture has a cumulative effect. So you'll do a treatment and then it'll have an effect, and then over time that will kind of wear off. So then if you're doing treatments and then another treatment in a week, another treatment in a week, kind of builds up the effect of it. Is there any proof signs that acupuncture increases egg quality? There is. The thing with acupuncture is that we don't have any large bodies in the Western world that are putting a lot of money into research. So there are small bodies, there are pockets of research going on, and there is a lot in China going on, research, obviously. But Chinese research isn't really well kind of appreciated in the West. Not appreciated is the wrong word, but it's not really taken in the same way as Western research is. And because we don't have that large body of funding for research, we don't have the ability to do lots of really high quality, large group, loads of participant studies. So the studies that there have been have shown that there is an increase in egg quality, that it will regulate hormones, reduce stress hormones, increase blood flow to the uterus. There are lots of different physiological things that we can see post acupuncture treatment. But the conclusion in most, if not all, of these research papers is that this result is promising, but we need larger studies to prove this effect. So whilst it's really encouraging and really reassuring that that information and those studies are out there showing that, we just need more funding and more research in these things to be able to prove beyond a shadow of a doubt that this is exactly what's going on and why. So I hope that is helpful. Does anybody have any more questions about acupuncture, about what it's like, what it feels like, if it would be specific and be helpful for your condition? I'm more than happy to share any links if you want any research materials, anything to look at. I'm more than happy to send them to Hannah to share with you. If you want to look at the research, just let me know. Someone says, is there beneficial also for males during fertility treatment? If there is an issue with male factor, then definitely yes. Also erectile dysfunction, acupuncture is really useful for helping with that. And if if your partner is particularly stressed or particularly anxious, then it can definitely be really helpful at helping with that as well, which is completely understandable. So yeah, there's lots we can do. I have a patient in at the moment who had really low motility, and that's been shown to be normal now after 10 sessions. So that's really a really good result. But again, it's really important that your partner has an acupuncturist that they can feel confident with and talk to these things about, because it can be really hard to talk about these things. Guys don't generally even go to see their doctor about any kind of health condition. So having someone that they can talk to and, share what's really going on, and not just kind of, yeah, everything's fine is really useful. Someone says, do you ever work with couples together or just individuals? I have worked with couples together, but I find that it can be more useful for couples to work with separate acupuncturists, just so that they can be really honest. Because if you know that your partner's going to see the same person, then it can always make you might not want to share something. So it's really important that you feel that you can talk about everything that's going on through your journey. So sometimes it can be really helpful just to see your own acupuncturist, and to know that even though, you know, everything is completely confidential and nothing is ever discussed with anybody else, it can be quite reassuring to be able to know that your acupuncturist doesn't know your partner, and anything that you share is completely in context of just that treatment. Okay, if there's no more questions, I'm going to stop the recording, and then if anybody wants to ask anything else, they can do.